Welcome to Hadassah on Call, New Frontiers in Medicine. I'm your host, Maayan Hoffman. Today, we're celebrating nurses, and especially midwives, as we mark National Nurses Week and International Nurses Day this May. Our guest is Gila Zarbiv, a certified nurse midwife at Hadassah Hospital Ein Kerem in Jerusalem. Originally from Pittsburgh, Gila made Aliyah in 2007. She's a mom of four, a PhD candidate at Ben Gurion University, and a powerful advocate for midwifery-led maternal care, a model proven to improve outcomes for both mothers and babies. During the pandemic, Gila showed incredible resilience, caring for COVID-positive mothers under the most difficult conditions. She's also been honored as one of Hadassah's 18 American Zionist women you should know for her passionate advocacy for Israel and women's health. Today, we'll hear Gila's inspiring journey, her vision for transforming global health systems, and why she believes midwives are key to the future of maternal care. So, let's get started. Welcome, Gila.
Thank you so much. Thank you for having me. It's really a pleasure and an honor.
No, of course. Now, your primary work is with pregnant women. Can you walk us through that role and kind of the day-to-day responsibilities of a midwife?
Absolutely. So a lot of that is going to depend on the context with which the midwife is working. So I'll describe what it looks like a little bit in Israel, and maybe we can touch a little bit what it looks like across the globe. But in Israel, midwives are primarily based in the hospital. They treat women during labor and birth. There are midwives who work in the community and in home birth and in it's called the kupot, like the healthcare centers. But the overwhelming majority of midwives in Israel are found in the hospital. We treat women in prenatal in the hospital clinics, in triage when they come in the OR, in labor and birth, and then for postpartum after the birth as well.
Now, in a previous conversation with Hadassah on Call, because we actually had the privilege of hosting you before on the podcast, you described midwifery as serene and intimate. How do you create that calm during such a high-stress moment? I myself am a mother of five and remember those deliveries.
That's such a good question. So midwifery, we like to say that midwifery is a world of extremes. When everything goes great, it goes really, really great. And then when things go wrong, it can be really not so great. And I think the key is, and this is a lot of what my work and my research focuses on, is having midwives by the woman's side. As long as the midwife is there and she's describing to them what's happening and she's explaining every process of the way, regardless of how so-called stressful or urgent or emergent the situation is, I find that reduces the trauma and the stress in the room, and that creates this serenity and intimacy throughout the entire process. And I think that's really key, is having the midwife by her side.
Amazing. I had the privilege of having two of my five children in Israel and a midwife 3 times, and I can completely relate to what you're saying. And actually thinking of that, how was giving birth in Israel at Hadassah, for example, differ from the experience in places like the US and Canada? I know you've been in both. And while I'm asking that, if you don't mind, what steps do you think Israel could actually take to align the childbirth practices that we see in some of the international standards, here in the country?
So that is the question. That's actually the whole question of my doctorate, of my PhD. And I think that the first concept is the midwifery scope. So the midwives, the WHO, which is the World Health Organization, has just come out with a position paper, which is a news breaking, what's the word, watershed article, where they essentially said that the world needs to adapt this model called continuity of midwife care. And essentially what the WHO and other organizations across the world are saying is that midwives need to be treating women across their entire healthcare continuum. And the difference between Israel and across the globe, you're touching on Canada, on America, but it's really the Netherlands, Switzerland, UK, all these countries have adapted this model, is that midwives are responsible for approximately 90% of the women's healthcare continuum. It's actually defined as sexual, reproductive, maternal, neonatal, and adolescent health. That's a huge scope that midwives can be providing. That's birth control, that's abortion care, that's family health planning. It's a huge, huge scope. And so Israel, on the one hand, has a great midwifery program, great midwifery care within the hospital. But the key lies in midwifery autonomy and independence. I think the next step for Israel and what we're working on and what I'm studying in my doctorate to get midwives to that international level is provide them with that 90% scope of practice, the SRM, NAH, and full autonomy and independence to be recognized as independent women's healthcare providers.
Is that something that does exist in the United States? I don't recall having had access to something like that.
So it is. It is something that is in the United States. The United States is not one of the best models when it comes to maternal health. It's actually the only developed world, the only wealthy country that their budget for women's health is rising and their morbidity and mortality of mothers and babies is also rising. So they're not necessarily a model for maternal health that I would specifically model, but their scope is large and broad, and their midwifery is exceptional. Midwives in America can be second surgeons in C-sections. They can close a cesarean. They provide full abortion care. They provide the scope for midwives in America is exceptional and definitely what we should be modeling. And more women in America should look for midwives and have access to midwives. But it's important to note that midwives are a multidisciplinary team. Like all medicine, my husband's a physician. No practitioner practices alone. Midwives work with OBGYNs, that's obstetricians and gynecologists, with pediatricians, with nurses, with nutritionists and social workers. It's a team, and midwives need to be an integral part of that team.
Now, you have spoken about consent and the Me Too movement. How has asking, "Do you allow me to touch you," changed interactions with patients, especially when you speak about this continuum of care and the different ways that you might be interacting?
Absolutely. So that was my master's thesis. My master's thesis studied the impact of the Me Too movement on midwives and OBGYNs, obstetricians and gynecologists in Israel. What we found was fascinating. Essentially, I'm not going to go into it because it's too long, but essentially the concept was that the Me Too movement is so specific for the field of midwifery and for the field of women's health because by definition, we have to do things that are considered intimate in order to do our jobs. I have to perform vaginal exams. A lot of times I perform anal exams, help women breastfeed. So how do we incorporate this new paradigm of the Me Too movement and making sure that women are fully informed of everything that's going on while maintaining our full scope of practice? And one of the things that I've adopted in my practice, that I've always done, but I'm much more sensitive, is I don't ask a woman, "May I examine you?" I don't ask her, I am going to perform the exam now, which isn't a question. I ask every step of the way, "May I lift the sheet? May I begin? May I touch you?" And I find that language, simplifying the language in Hebrew, it's אפשר לגעת בה, אפשר להתחיל את הבדיקה, אפשר להרים את השמיכה. Can I lift the sheet? Can I touch you? May I begin the exam? And I find that when I break it up into these little steps and I'm very specific about what I'm asking, it gives the women the empowerment to give full consent. And a lot of times they'll say, "No, I'm not ready. I'm not ready. Give me a minute, please. Don't lift the sheet. I'm not ready for this exam." And I find that when you return the power and you go back to women-centered care, which is what midwifery and women's health is all about, going back to the question of serenity and calm, it creates a completely different environment in the room.
Well, it's interesting. Me Too, I guess, what was that, 2 years ago, 3 years ago, that this really became the big thing here in Israel? Obviously, the biggest fundamental shift has been, unfortunately, the October 7th massacre and obviously the resulting war, but certainly the massacre. I'm wondering, how your work has changed since that moment, especially given all of the different, the terrible tragedies, I guess I would say, that happened to so many women living down south. Um, have any of the pregnant or mothers that you work with, or the pregnant women or mothers that you work with, been affected directly, and has it affected your job in general?
So the answer is absolutely. I don't think that there's a single woman in Israel who has not been affected directly by the happenings of October 7th, the massacre on October 7th. From my perspective as a previous board member of the International Midwives Association, and you should reach out, the Israel Midwives Association has done incredible things since the October 7th massacre. But from my work as a previous board member, when October 7th happened, we turned to international organizations, specifically asking them to call out Hamas for their terrorist attack, call out the gender-based violence that happened on that day, write papers and speak out against the women. And it was a moment of strong reckoning for us in Israel when we realized that the words "believe all women" don't apply to Israeli women. And we were told in secret, "We stand with you and we're sorry for what happened." But in public and on the international scale, we were alone. And it was a very intense moment of reckoning and a horrific moment of reckoning. And for the women in Israel, a lot of them are either birthing alone because their husbands are at war, or they've lost their significant others, or their husbands are in tunnels underground in Gaza. There's a midwife whose nephew, Alon Ohel, is being held captive underground in Gaza in tunnels in horrific conditions. So there's no one who's not affected, and the country is so small. And I think that it's created this moment of a rally cry for the midwives. The Israel Midwives Association created multiple organizations to stand with women. One is called Letzidech, and they can speak more to it. And the people who are more involved in the current board and the president, Tanya and Yuval, the president and CEO, exceptional women who are doing incredible things. Israel Midwives Association has created Letzidech, which means by your side, where they have every woman who has lost a significant other has a midwife by her side from the moment she requests her in pregnancy and both birth and postpartum. They also have different programs that they've created for the North to have women have easier access to care, working with Magen David Adom. So it's absolutely impacted every birthing woman, every woman, and every human in the region, and directly impacted the scope of midwifery in our work.
And the other thing that came out of October 7th is a lot of the anti-Semitism that was, I would say, more covert before has become very overt, and we're starting to see it surface. And certainly it's impacted the entire healthcare industry, and you're abroad right now. And I'm wondering, have you personally experienced any anti-Semitism, either in your work or your daily life there? And in what ways do you think the healthcare system can engage on a global level to better address it and confront it so it doesn't impact patient care?
These are like the most amazing questions and the big questions. And I wish that the whole world was asking these questions. I personally have experienced anti-Semitism. I've experienced anti-Semitism ever since I was a little girl growing up in Pittsburgh, Pennsylvania. And I remember we would go to like amusement parks, and I grew up very religious. So I wore long skirts and long sleeves, and I wasn't allowed to wear pants. And I was always asked, "Are you Amish? Why are you dressed like that?" I remember people laughing at me since I was a little girl. But when we started to take October 7th to a global scale and turn to associations and ask for support, the responses that we got were things like, and this was told to us by a person very high in the echelons of women's health organizations: how do we know that these atrocities are not taking place on the other side? Meaning, we can't stand with you because maybe Israeli soldiers are doing the same thing. Which, no, the fact that that question wasn't even on the table, the fact that they were afraid to stand or afraid to take the testimonies and the overwhelming forensic witness, survivor, and victim evidence that was undisputable and undeniable at face value is direct anti-Semitism, in my opinion, to the women and to the people of Israel. And it's also very important to note, and this is to answer your second question about the global health community, these were not Israelis that were attacked. These were humans. The people who were attacked and murdered, we all know now, who were massacred, took place from Thailand to the UK to Russia to America to Israel. These were human beings who were attacked. And the world needs to take a moment and do some, we have a word in Hebrew, cheshbon nefesh. They need to do an internal exam, and they need to ask themselves, are all these things that we're paying lip service to, believe all women, end gender-based violence, humanity, stand for humanity, stand for justice, are we actually putting them into action, or are they simply words? I think the world had a moment, not just the globe, but the healthcare, specific women's healthcare world had a moment to stand with women, regardless of politics, and make a statement that said, women are women wherever they are. And they missed that opportunity. And I think a huge reckoning is required for these global health institutions that claim to stand for women and women's health.
Yeah, I want to move a little bit over to the actual day-to-day work and some of the misconceptions about midwifery and the role that the midwife plays in the modern healthcare system. You spoke about this continuum of care, but I don't know that everybody yet sees it that way.
Absolutely. So that's really I think that's the most important question. As we discuss these gender-based violence issues, and we look at the world today, what's happening in Afghanistan, I don't know if you're familiar, or if your viewers are familiar, but women are now being banned from studying midwifery in Afghanistan. That means that pregnant Afghanistan women will have to go to men practitioners They can't leave their house alone. They may not be alone with men. The implications of such laws are directly resulting in death without question. Women will die because of these laws. And the answer to a lot of the issues that women are facing in the world are midwives. And what does that mean? So it means that what the global scope should look like is that midwives should be treating women, as we said, across SRM, NAH, sexual, reproductive, maternal, neonatal, and adolescent health. We should be treating for 90% of women's healthcare. But like you said, there are so many misconceptions. People have literally said to me, "You're a midwife? Isn't that a biblical phenomenon?" No, I'm not a biblical phenomenon. I am a modern day phenomenon who has been around since the beginning of time. Since there were humans, there was somebody delivering the humans, somebody helping the women. Someone said to me once that I was wrong and that prostitutes were the oldest profession. But there were midwives delivering the prostitutes. There were midwives helping the prostitutes birth, giving them their health care. There have always been midwives since the beginning of time. So to find that juxtaposition, so to say, between us being an ancient profession with all this knowledge of over thousands of years, yet finding our place in the modern world, I think we need to rebrand the midwife. I think we need to start explaining to the world that I am a clinical healthcare provider who provides up to 90% of women's health, who has a global evidence-based record of reducing maternal and neonatal morbidity and mortality, and that access to a midwife saves lives. A recent study came out and found that if every woman in the world had access to a midwife, we could save 4.3 million lives by 2030.
What kind of training do you get to be a midwife? Like, how do you become this clinical practitioner?
So in Israel, all midwives are nurses. You must first go through nursing school. The schooling for midwifery is incredibly long and grueling. It's 4 years of nursing school, 2 years of midwifery school, and then another 6 months of like what you call Hadassah, 3 to 6 months, and that's like a probation period. And only then you can really start to go on your own. It's a total of 6 or 7 years to become a midwife. Across the globe, not all midwives are nurses. There are programs that have direct entry midwifery courses, but in Israel, all midwives have to first go through nursing school and then school.
So, what do you wish that more people then understood about this field in Israel?
Well, the first thing that I want people to know in Israel is that the women of Israel need to start asking, where is my midwife? Why do I not have the basic human right to choose my medical practitioner? Why am I forced to see my midwife exclusively in the labor and delivery ward? Why doesn't the country allow me to choose who I want to see throughout pregnancy, birth, and the postnatal period, and even before with regards to family planning, birth control, STIs, and more, which is sexually transmitted infections and more? The women of Israel have a basic human right to choose who follows them. In Israel, there is a huge bottleneck. Women prefer to see female OBGYNs, female women's health providers, physicians. And the Kupot, there was an article that said that the health insurance companies were willing to pay 1,000 shekel an hour to female OBGYNs due to that demand. We can lower costs for the health insurance. We can lower costs for the women. We can raise access. You won't have to wait. There are women who wait in the periphery for months to see a provider because of this bottlenecking. The women there is an answer in the country to these issues. I'm right here, and we're ready, willing, and able to go out and see the women as we should be, as independent, autonomous healthcare providers.
So, in other words, what would happen is that you would become like not necessarily a substitute, but in addition to a female OBGYN. And then that way, the women that needed to have care could actually access the wealth of midwives that are in the country before or in lieu of an OBGYN when they don't really need an OBGYN. And actually, the midwife could provide total care. Did I understand that correctly?
You said it perfectly. And I love how you said not instead of, because again, our scope is very specific. Just like an OBGYN scope is very specific, just like no practitioner practices alone. An OBGYN isn't going to perform heart surgery, and a nutritionist isn't going to deliver babies, and so on and so forth. Everyone has their scope. We work together. The midwives are experts in preventative medicine. That means that we can take all the women who have low risk and we can help them, so that the women who really need a physician, they have serious high risks, very debilitating diseases. They require constant high risk care. They need physicians. The physicians need to be getting to these women. But if the physicians are seeing all the low risk women who simply need that ma'akav, that follow up, then the women who desperately need physicians aren't able to get to them. So it's not instead of, it's just simply giving access where the access should go.
Great. Now, I did read about you, beforehand, because first of all, you were on our show, and also there's been quite a bit written about you because you're dynamic. And I was reading about your involvement in this very emotional story where you delivered a 24-week-old baby from in a very remote Arab village. How does an experience like that as an American and Israeli shape your view of Hadassah, first of all, as a place of healing, and second of all, as a place of coexistence? And I think especially today, now a little bit later, when Israeli society has become even more complex.
Yeah. And I think that if the world understood how the hospitals worked, I think that there would be a lot less misconceptions. That specific story was a really meaningful story because later she told me that I was the first Jew she had ever encountered, which wasn't my first time, but the story was so dramatic of her coming in and delivering this severe preterm child, and all of the love and care and support that she received, while later finding out that that was her first interaction with a Jewish Israeli midwife in a Jewish Israeli hospital. But working specifically in Hadassah, and I love Hadassah, I love Hadassah, but Hadassah is not unique in the sense all hospitals across Israel follow this format. The people who work in these hospitals are Muslims, they're Christians, they're Jews, they're Druze, they're unaffiliated atheists, not religious, and everybody works together for this greater good of humanity, of simply saving lives. And I wonder sometimes why the rest of society can't function the way that these hospitals work. Nobody says, what kind of a doctor is this person? What kind of a midwife is this person? What kind of a patient? When a patient walks in the door, and I say this all the time, I've said this before in talks with Hadassah, but I really believe Hadassah is like an oasis of peace. When someone walks in the door, nobody says, "Who did you vote for? What color is your skin? What is your political beliefs?" We simply see every person, and in my experience, every woman, as a human being in need of the highest standard of care, and it works, and it's an incredible thing. And I wonder why the world doesn't know about it when they call Israel an apartheid and all women are being treated from Gaza and the West Bank are coming into our hospitals. And you and I know that if I were to go into Gaza or the West Bank, I don't believe I would be given the same treatment that the women are given. So why doesn't the world know? And why doesn't it work outside of the walls of medical institutions?
So, Gila, we've been talking about so many tragedies over the last 18 months and challenges, but if you could picture a better world, if you could have it your way in your field, what would it look like in this region?
That's a really, really important question. I think the answer is really, really simple. I envision where all people, all humans work together for humans. That means that when I hear about what's happening in Gaza, it's horrific. The death of a human being, of a mother, of a child, anywhere across any region is horrifying and it's tragic. And the vision would essentially be that I would be honored to work together with my midwife counterparts in the West Bank, in Gaza, wherever they are, across Iran and Syria and Lebanon. Women need to work together for women. People need to work together for people. And we can see people as people, treat humans and humans, and give everybody the highest standard of care, regardless of where they live or what they believe in.
Yeah, I wish we could only answer those questions. I think Israel and the environment would be such a different place. I was in Nablus today, and it's just such a different world than what we're used to here in Jerusalem or in Israel. Tell me something. Was you talk about the modern midwifery? Are there any new procedures or innovations that are happening at Hadassah that are improving care for expected mothers? Something that we should know about?
There are so many. I mean, the one that I talked about specifically with that baby, and for that you should also speak to my head Orik Moshe, who's exceptional, the head midwife, and there's Shlomi Alomi, who's in charge of labor and delivery, and so many other exceptional people to get more specifics. But Hadassah truly is on the cutting edge. One of the things you spoke about was COVID, and my work with COVID, I had the distinct honor, along with an exceptional midwife named Noah Ben Yael, to deliver the first COVID baby in the country. And I think that it's not random that Hadassah delivered the baby with the first COVID mother. The baby was negative, but the mother was positive. It was our first COVID birth in the country. And I think that the reason why it happened in Hadassah is not by chance. Hadassah is always innovating. They are working according to the evidence. They are constantly looking at the research. For example, of the 24-week-old baby, there's this concept of delayed cord clamping, where these preemies are delivered, the cord is left intact, and resuscitation takes place while the baby's getting blood from the mother, from the placenta, essentially raising the blood volume load and preventing a cascade of complications. These are new procedures and cutting edge concepts that aren't easily adapted as quickly as I find that these things are adapted in Israel, in Hadassah. And though that's always happening, always innovating, always changing, and always making sure and ensuring that we stand up with the highest level of evidence.
So, I mean, hopefully this will not pertain to me, but I am curious if you could give us some advice for mothers that are starting out their pregnancy journey. What is the newest advice that you would give to new mothers?
The first advice I would give to a new mother is find a midwife. Ask your health provider, how can I get access to a midwife? Because I heard on a podcast with Hadassah on Call that midwives save lives and that they provide holistic women-centered care where they see the woman and put the woman in the center. So how do I get a midwife? And turn to the Israel Midwives Association and demand a midwife. Demand a midwife. Change happens for many reasons. It can happen through the association, but can also happen from the women. And if every woman knew that she had a right to demand a midwife and how important midwives were in her trajectory for her pregnancy, her birth, her postnatal, and beyond, I think that we would see a lot more demand. So first of all, find a midwife. Demand a midwife. And second of all, everything's going to be okay. There's an incredible group that the Israel Midwives Association started called midwifery-led. It's on Facebook. You can find it. It means the word of a midwife in Hebrew. And you can ask all your questions there. There's always someone to answer your questions. There's always an answer. Don't panic. I'm here. You can always reach out and everything's going to be okay. Take it moment by moment. Enjoy the process and find yourself a midwife.
Beautiful. Well, I certainly enjoyed talking to you so much today. Thank you, Gila Zarbiv, for being here today.
Thank you so much. The honor is all mine, and I'm so grateful.